Welcome back, everyone. Ready for another deep dive?
Absolutely. Always excited to dig into some new research.
Well, today we're diving into the world of plastic surgery.
Ooh, interesting.
Yeah, and specifically looking at trends across the U.S.
Okay, so like what's hot in Miami versus LA?
Exactly. You sent us this fascinating paper from 2016.
Okay.
It's called "Plastic Surgery Statistics in the U.S: Evidence and Implications," and it really gets into how these trends vary by region.
Regional trends. Okay.
Yeah, so, we often hear about the most popular procedures nationwide, but this research looks at, why certain things might be more popular in one part of the country compared to another.
That makes sense. Like, are we talking about weather or something? Does that affect things?
Well, we'll get to that, but first let's look at some of the data. This paper uses information from the American Society of Plastic Surgeons,
Okay, a pretty authoritative source.
and it highlights that in 2013, the Mountain Pacific region had the highest total number of procedures.
Mountain Pacific. So we're talking California, Arizona, that area.
Yep, exactly. And we're talking a full 30% nationwide.
30%. Wow, that's a big chunk. So basically, like a third of all procedures are happening in those states.
Pretty much. But here's where it gets interesting, right? When you adjust for population density.
Right, because those states are pretty populous.
Exactly. The picture changes a little bit.
Oh, really? How so?
Well, the Mountain Pacific region still leads,
Okay.
but their share drops to about 26%.
Okay, so still the highest, but not by as much.
And what I found really interesting is that the East and West South Central regions actually move up in the rankings when you account for population.
That's kind of surprising, isn't it? You'd think more surgeons in an area would just automatically mean more procedures happening, but it sounds like that's not necessarily the case.
It's more about how the workload is distributed. So if there are more surgeons in a region, each one might just perform fewer procedures on average.
Oh, I see. So it's about spreading out the work rather than just everyone doing tons and tons of surgeries.
Exactly. Now, one thing that really caught my eye in this paper is the idea that weather might actually play a role in regional preferences for certain types of procedures.
Wait, weather? Really? How does that come into play?
Right. So the authors suggest that in warmer, sunnier regions where people tend to wear less clothing,
Right, like think beachwear all the time.
there might be more of an emphasis on body-focused procedures.
So maybe more breast augmentations in those areas.
Exactly.
That kind of makes sense, right? If you're showing more skin, you might be more focused on those aspects of your appearance.
And conversely, in places like the Northeast, where the climate's colder and people are bundled up more often,
Marcas and scarves all winter long.
we might see a higher proportion of facial procedures.
Ah, so like rhinoplasties and facelifts. Interesting. It seems counterintuitive, but I guess your face is what's on display when the rest of you is covered up.
That's the thinking. It's like our environment and what we're exposed to can actually influence our perceptions of beauty and what we choose to change.
Wow, that's pretty deep. I never really thought about it that way.
It's almost like different regions have their own unspoken beauty standards.
Hmm. So it's not just about what's objectively beautiful, but what's considered beautiful within that particular context.
Exactly. And speaking of beauty standards, the research also looked at the top 5 most popular procedures across the U.S. in 2013.
The classics, huh?
Nationally, it was breast augmentations, rhinoplasties, blepharoplasties, that's eyelid surgery, liposuction, and facelifts.
Yeah, those are the ones you always hear about. But I bet it gets more interesting when you break it down by region, right?
Absolutely. And that's what we'll get into next.
Can't wait.
Stay tuned.
All right, so let's get back to those regional differences, those trends we were talking about.
Yeah, I'm really curious to see how those top 5 procedures actually break down geographically.
Well, get ready for some surprises because the numbers are they're pretty striking.
Okay, lay it on me.
So remember, we're talking about breast augmentations, rhinoplasties, blepharoplasties, that's the eyelid surgery.
Right, liposuction and facelifts.
Yes, exactly. Those were the most common procedures nationwide, but when you start looking at them by region, it's like it really does paint a different picture.
So, like, different parts of the country have different priorities when it comes to plastic surgery.
It seems that way. For example, take breast augmentations.
Okay.
The Mountain Pacific region accounted for a whopping 36% of all those procedures in 2013.
Wow, so over a third of all breast augmentations in the entire country were happening in that region.
That's right. Meanwhile, the New England Middle Atlantic region only accounted for 15%.
So more than double the percentage on the West Coast compared to the Northeast.
Yeah, that's a pretty significant difference when you say it makes you wonder what's driving those choices, right?
Right. Like, is it just personal preference?
Mhm.
Or are there, like, cultural factors at play? Maybe even access to different types of surgeons?
Well, those are all questions that the researchers tried to address in this paper, and
Very
they
fair.
point out that chin augmentations show a similar pattern.
Oh, really? So it's not just about breast augmentations.
Nope, it seems like there's a trend in that Mountain Pacific region towards certain types of, aesthetic goals.
Interesting. So the West Coast is really driving the national numbers in a few of these categories.
It seems that way. Now, blepharoplasty or eyelid surgery, that's another one that varies quite a bit by region.
Oh, how so?
The Mountain Pacific region actually performs twice as many blepharoplasties as both the East and West North Central region and the East and West South Central region.
Wow. Okay, so if you're thinking about getting eyelid surgery, head west, I guess.
Huh. Well, maybe not, but it is interesting to see how these patterns emerge.
What about liposuction? Does that follow a similar trend?
Liposuction's interesting. The biggest difference in demand is actually between the South Atlantic region and the Mountain Pacific region.
Okay, so it's not just one region dominating across the board.
Right.
So what explains these differences? Is it just random chance, or are there actual underlying factors at play?
Well, that's the million-dollar question, isn't it? The researchers suggest a combination of factors might be contributing to these regional variations.
Like what?
Well, we've already talked about weather and cultural norms,
Right.
but they also point to things like self-perpetuating trends.
Self-perpetuating trends. What does that even mean?
So it's the idea that the more prevalent a procedure is in a region, the more it can actually influence the choices of future patients.
Oh, I see.
So if someone sees a lot of people in their community getting, say, rhinoplasties, they might be more likely to consider it themselves, even if they wouldn't have
Like
otherwise.
a social feedback loop, right?
Exactly. The more common something becomes, the more normalized it becomes, and then, well, the more people start to think about it as an option.
It's fascinating how these things can shape our perceptions of what's considered normal or desirable.
It really is. And then the paper also brings up another intriguing point, the idea that economic conditions could play a role.
Oh, that's interesting. I guess people who are more financially stable might have more disposable income to spend on elective procedures like plastic surgery.
Right, that's one way to look at it.
But is there another way?
Well, the researchers also suggest that economic downturns could potentially lead to an increase in certain types of
Oh,
procedure.
really? Why would that be?
Well, think about it this way. If people are worried about job security, they might be more likely to invest in things that they perceive as boosting their professional image
Oh, I see.
or increasing their competitiveness in the job market.
So it's not just about having money to spend. It's also about how people might view plastic surgery as an investment in themselves, especially during uncertain times.
Exactly. It's like a complex relationship between our personal choices, societal pressures, and, well, economic realities.
Definitely a multifaceted issue. But, it's important to acknowledge that while we can look at these trends and speculate about the reasons behind them, ultimately, it's a personal decision.
Absolutely.
There are countless reasons why someone might choose to have plastic surgery. And it's not always about, conforming to some societal standard of beauty.
Right. It's about individual choice and respecting that.
So we're seeing a more nuanced picture emerge here, right?
Yes. It's not just about vanity. It's about a lot of things.
And seems like the researchers themselves acknowledge that there's still a lot more to learn.
They do. In fact, they even suggest a different way of categorizing regions.
Oh, really? Tell me more.
So instead of these, very specific regional breakdowns, they propose grouping states into four broader categories: West, Northeast, South, and Midwest.
That makes sense.
They argue that this classification might better reflect, the underlying cultural and demographic trends that influence plastic surgery preferences.
I see. So instead of lumping all of the West Coast states together, for example, we might be able to see more nuanced differences within that region.
Exactly. And ultimately, they call for more granular data collection and analysis to really get a handle on the complexity of these trends.
Imagine if we had data at the state, county, or even city level.
Right. It would be like zooming in on a map and seeing the finer details of these trends.
We could see how preferences vary even within smaller geographic areas, and maybe even identify hyper-local trends.
It would be a goldmine of information for anyone interested in, the sociology of beauty, consumer behavior, all those fascinating cultural forces that shape our perception.
And for plastic surgeons themselves, right?
Absolutely. It could help them understand the specific needs and desires of their patients.
It would allow them to tailor their services in a way that's, more responsive to their local market.
So we're just scratching the surface here, really.
There's so much more to explore.
So many more questions to ask.
Wow, it really feels like we've only just begun to uncover all the different angles of this topic.
I know, right? It's amazing how much depth there is to something like plastic surgery trends when you really start to dig in.
So as we wrap up our deep dive today, what would you say are some of the key takeaways for our listener?
Well, I think the biggest one is that, these trends are way more complex than we might think at first glance. It's not just a simple list of popular procedures. There are all these regional, cultural, even economic factors that come into play.
Right, and we saw how raw numbers can be really misleading without taking those things into account,
Yeah.
like population density and regional variation.
Exactly. And we also saw how things like weather, cultural norms, even just how prevalent certain procedures already are in a community, all of that can influence individual decisions.
It really highlighted for me how much our environment and our social context can shape our perceptions of beauty and what we choose to change.
Absolutely. And another big takeaway for me is that there's still so much more research to be done in this area.
The paper we looked at today even pointed out some limitations in how the data is currently collected and analyzed.
Right. And they suggested that more granular data could reveal even deeper insights.
Like imagine if we had data at the state, county, or even city level.
Oh, the things we could learn. We could track how beauty standards evolve over time, how they vary across different communities, and how they're influenced by things like media representation, economic conditions, all of that.
It would be like watching a cultural map unfold in real time.
Exactly. And I think for plastic surgeons themselves, this kind of data could be incredibly valuable.
Oh, absolutely.
It would help them understand the specific needs and desires of their patient population.
And tailor their services in a way that's, really responsive to their local market.
So, as we wrap up here, if there's one thing I want our listener to walk away thinking about, it's this. These choices, they're deeply personal.
They are.
And there's no one-size-fits-all explanation for why someone might choose to have a certain procedure or why a certain trend emerges in a particular area. It's about respecting individual choices, recognizing the complexity of these decisions.
It's about approaching this topic with, a sense of curiosity and empathy.
Yes, exactly. And, it makes me think back to something we discussed earlier about how economic conditions can play a role in these decisions.
Right, right.
For some people, plastic surgery might be seen as a luxury, something they splurge on when they're feeling financially secure.
But for others, it might be seen as an investment.
An investment in themselves, their confidence, their career prospects.
A way to feel better about themselves during a difficult time.
It's a reminder that these choices aren't always about vanity or, conforming to some societal pressure. There are often deeper motivations at play.
And we should be sensitive to those individual stories.
This whole deep dive has been a great reminder that even with something like plastic surgery trends, there's always more than meets the eye.
I couldn't agree more.
So for our listener out there, I would leave you with this question. What are some of the unspoken beauty standards in your own community?
That's a good one.
And how do you think they might be influenced by the factors we discussed today? Keep those questions in mind as you continue to explore this fascinating, ever-evolving world.
Well, thank you so much for joining us for this deep dive into the world of plastic surgery trends.
It's been a pleasure.
And thanks to our listener for sending in this thought-provoking research.
Always love getting recommendations from you all.
We'll see you next time for another exploration into the world of fascinating research.
Until then.